think it's, can you see it? You see it's recording?
Yep, we're
Okay,
good.
I'm gonna mute myself and go whenever you need.
Awesome. Okay, hi everybody. This is PJ down at the bottom, Rebecca and Matthew up at the top. We're doing our marijuana presentation for the substance abuse disorders class with Dr. Beinart. Go ahead, hit next, and we'll get started. So the first thing we wanted to do is just kind of define what marijuana is and what the substance is. A proper definition by the National Institute on Drug Abuse is marijuana, also called weed, herb, pot, grass, bud, ghana, I don't know how to say that one, Mary Jane, and a number of other slang terms, is a greenish gray mixture of the dried flowers of cannabis sativa. So basically, this weed plant, the main psychoactive drug in it is THC. And this is the main chemical that's responsible for most of the intoxicating effects that we see. So there's different forms of consumption. You can smoke it with joints, pipes, things like that. It can be brewed into different kind of drinks, especially tea. And it can be baked into foods for consumption. And that's usually through, for medicinal uses, that's what usually happens. And then the stronger, more concentrated forms of this drug, like hash, oil, wax, and other types, are used more recreationally, and those can be more highly abused because they are stronger. Go ahead and hit next. Okay, so the effects of marijuana. Obviously, there's pretty severe effects to your psychological state because you're being given a drug that affects that part of your brain, but different ways of consuming it affects you in different ways. So smoked consumption, once the THC and other chemicals is inhaled into your lungs, it passes through the bloodstream and into your brain and throughout your body. So the effects by this consumption are felt almost immediately because it enters your bloodstream so quickly. Edible consumption, however, is differently, and it enters your body and affects you significantly less because of the significant delay of time. So it could take up to 30 minutes to an hour. And because of this, people tend to overconsume at that rate because it does have to pass through the digestive system first. Then overall, many people experience a pleasant euphoria and sense of relaxation. Other common effects, which may vary dramatically among different people, include heightened sensory perception, brighter colors, laughter, altered perception of time, and increased appetite. So the overall effects for in all consumption types, majority of the time, people usually, like I said, experience a pleasant effect, such as like relaxation or euphoria. And this is why the drug is usually used to help with anxiety and stress and things like that. And so people will think, well, oh, that will help me with that panic or the fear or the anxiety that I'm having. And these effects are common, but sometimes, unfortunately, people experience maybe a different kind of effect, like a panic attack or distrust or extreme fear or paranoia. And so sometimes if someone consumes too much or they're unexperienced or the marijuana is large doses of marijuana may cause a pain in the bloodstream and throughout the body for several days, but the effects typically only last hours. So usually you won't have those effects for very long, but the marijuana and the THC will stay in your bloodstream for a long time. Go ahead. Okay, so there's different things that we could talk about here with addiction of marijuana, but some of the main things that we wanted to point out is how addictive marijuana actually is. So this quote from an article I was reading about the addiction effects of marijuana says, about 9% of those who try marijuana develop a dependence compared to, for example, 15% of people who try cocaine and 24% of those who try heroin. And that really doesn't sound like that much, 9%. That's like, we could say like no big deal. But if you keep reading, it says because so many people use marijuana, cannabis dependence is twice as prevalent and as dependence on any other illicit psychoactive substance. So because of people using it more actively and more frequently and it being more normalized, people become more addicted at a higher rate actually. And the rise in marijuana use disorders treatment admissions for primary marijuana dependence have increased both in the absolute numbers and as a percentage in total admissions from 7% in 1993 to 16% in 2003. And I'm sure that number has increased since 2003. So here are some symptoms and signs of addiction. Obviously, you're going to experience withdrawal, just like any other kind of substance. You're going to experience irritability, sleeplessness, decreased appetite, and anxiety, and kind of like a drug craving, like you would with other substances. Behavioral things you would experience are distorted perception, impaired coordination, and maybe memory problems or learning problems. Physical addiction signs are bloodshot eyes, a mucus-filled cough, being really hungry, like more hungry than normal, having a rapid heartbeat or unable to slow your heart rate down, extreme anxiety, and then fear and paranoia.
All right, I thought we'd give you a little bit of information on how prevalent this is, especially among high school people. So after years of it actually decreasing in adolescence, in 2019, the numbers started to go up and it's started to become a lot more prevalent. And so these are some statistics from NIDA, the National Institute on Drug Abuse, and then also SAMHSA, the Substance Abuse Mental Health Services Administration. So in 2020, 28% of 10th graders had tried marijuana in the last year and 16.6% in the last month. So it's almost a little bit higher than 1 out of every 4 sophomores has tried marijuana. Also amongst 12th graders, 35% in the last year had tried marijuana, and also 21% in the last month. So it's considerably higher. Also, according to SAMHSA, 22% of substance abuse related emergency department visits were for marijuana. And so that was the second highest substance abuse related visit. Only meth was higher at 33%. We talked more about how it can become addicting. And according to SAMHSA, 1 in 6 youth who start before 18 can become addicted. Very considerable.
Okay, so before we dive into some more treatment type things, we wanted to quickly talk about the stigmatization of marijuana and the use of it. So obviously, like PJ just talked about for us, there is a great prevalence of this drug being used and misused within society today. And because of that, there's a lot of stigmatizations around how you use it and what uses are good or maybe not good. So quickly wanted to point out some article quotes that we found when researching this. So the stigmatization, first of all, of medical marijuana. So that would be people using it for a medical diagnosis that they've received. This has short-term and long-term effects, obviously. So patients who perceive stigma may experience chronic stress, which frequently manifests itself in withdrawal and isolation. So when they receive stigma, they're not going to really want to use the drug. So then that might cause them to withdraw, cause them to do other things, isolate, those types of things. Another thing it might do is it might dissuade potential patients in seeking treatment, which medical marijuana may provide relief. And these things are both true. Medical marijuana can help patients, and there's significant studies and proof to show that medical marijuana can help a lot of people in distress and pain, especially. However, the stigma of that would be that people think that just a small illness or a small medical diagnosis that's really self-diagnosed, that they start using that marijuana not medically. And that becomes where people become addicted to it and using it or misusing it, I should say. So the last quote down there, it says, the stigma of addiction is seen as a primary barrier to the effective addiction prevention, treatment, and recovery efforts at the individual, family, community, and societal levels. Addiction stigma prevents too many people from getting the help that they need. And this is true for every substance abuse that we're going to talk about in this class and that we have talked about. But primarily within society today, that stigma is going to be a big barrier for the patient getting the treatment that they need and the help that they need. That's all I have.
All right, so let's talk about the support, recovery, what you can do to help someone that you know, whether it be a friend or a family who is struggling with the addiction, whether it be, in this case, it's going to be marijuana, but in any sort of drug, substance abuse disorder. So just some things to keep in mind is to ask your question to yourself: how do I approach someone who is in recovery? Someone who has made the choice, like, I want to do this, I want to get healthy. How do I approach that? I thought of some 3 questions that are kind of like, that should be kind of floating around. Where is my bias? I mean, you hear that like actual phrase, once a stoner, always a stoner. Once a cheater, always a cheater. And that's not necessarily true. If anything, you're enforcing that more into their life. And in what ways can I understand their personhood? Where can I put myself in their shoes? Where can I actually see this process through their eyes? And when do I need to pour in and when do I need to back off? Those are some really great ways to understand yourself and your relationship to them, because this provides a big trusting environment for them. Like I'll show you some examples of how peer support can really help, but it just makes the recovery process an actual process rather than just this obligation they have to go through. Okay, so just those are some things to keep in mind. I wanted to kind of point this out. This is from an article of Health and Social Work Journal, and they focused on the American Indian perspectives on addiction and recovery. This was in the 90s. They focused more on women who were suffering from drug abuse as well as alcohol abuse. And they were pointing out some certain ideologies and mannerisms that American Indians would do. And they had this kind of cool orientation there called tribal versus non-tribal orientation. A tribal community is circular. They surround it, and they quoted integrated toward a center. There's a center person or center family that you look to in this as chief. And let's see. So they want to integrate a physical, emotional, and spiritual mentality when they're approaching someone who's struggling with addiction. And just similar to what we always talk about, the biopsychosocial spiritual aspect of our clinical perspectives. And their focus is to heal the spirit first, to heal what's ever inside. And while that happens, it can only happen when others are surrounding and moving closer to the individual. And that goes into more the spirit part of a human being. And that is very interesting. I think that's remarkable that that's how they saw recovery. And I'm sure they used it for many other things as well, but in this case, it was addiction recovery. And I think to have that mindset of like, we're going to take care of the inside first, and then we can go on the outside, but we need to draw ourselves closer. Okay, so that's one thing to keep in mind. This is a case study that came up, University of Pennsylvania, the medicine department. It was called Social Support and 12-Step Recovery Involvement. It's involved with drug addiction users. They got 489 adults with drug abuse in recovery and for IOP, which is intensive outpatient care, from the years 2004 to 2009. Their goal was to see what types of social networks helped foster a better recovery, a better less usage of relapse or coming back into drug addiction. And they split it up into 2 of them, a friend social support and familial social support. The friend social support motivated the recovering addict to change their life overall. So just anything in their life, overall, it would be changed. Like that's what their goal was. And they found the most help from their friends in that regard. In terms of family, that increased the readiness for an addict to reach the actual substance abuse goal. So if I'm like, I'm not gonna use except only 2 times this week, and it would work down from there. They used many different assessments throughout the way. They would take markers at 3, 6, 9 months, all the way up to 24 months over these years. And basically the overall consensus was that peer support groups with friends or family proved that the less substance abuse happened for a recovering addict. So the more people poured into their lives, the more connection they had, the less they were likely to use substance abuse. I'm just going to go from the first point of this, but this is just something to help families understand how to support another family member in addiction. Okay, in this case, marijuana addiction or whatever drug abuse addiction. Understand that you are okay for wanting to care for your loved one. It's not a bad thing. That is totally natural and it's totally fine. It's just how you do it is what matters. Okay. Just like many 12-step programs, like I said earlier, social peer support are key to recovery. Study after study after study engages that ideology that we need people to heal. Okay. Sorry for the noise. There's a lot of hail. It might burst through my roof. We need to discover the reason why they use, whether it be peer pressure out of curiosity, fitting in, anxiety, stress, depression, spiritual abuse, whatever the case may be, is the family's job to understand that and kind of discover it as a family. Also, this is very interesting. When we have differences in recovery and how we think we need to recover, it sets unlikely expectations for the addict. So whatever you think whatever you think they need to recover, it's probably not going to be that way. It's going to be the way they need to recover, not the way you want to recover. So we need to be on the same page of recovery planning as they are, whether it be from your therapist or whatever, be on that same page. Like I said, targeting communication amongst the family members improves cohesion between recovering addict and family members. So understanding how you communicate to your loved one who's struggling with addiction, and nipping whatever negative types of communication in the butt is always a best option to have connection through there. Okay. It's not always going to be perfect. All right. But it's a process as well. Be patient, be open, and be all in. The last thing someone who's struggling is want someone to give up on them. No one wants to be given up on, especially from a family member. And you can do those things. Be patient, be open, be all in. Take it away.
All right. So some more advice again for the families who have an addict in their family. It's important to check in frequently on how they're doing, not in a overbearing way or condescending way, but in a way that, again, as Matt said, that it cares for them and wants the best for them. Easiest to choose informal times to talk. Be easier to communicate with them if you're doing things where they're already relaxed, such as being in the car, at dinner, watching TV. Maybe doing some kind of a sport activity. You want to be clear and consistent about your expectations regarding their drug use. So some parents might be afraid to make those expectations, but overall, setting those boundaries is going to help the recovery of the addict. Another thing you can do is establish family agreements when you go out for a social event or an extracurricular activity. So you can agree, hey, we're not going to, maybe we're going to stick together, or we're not going to use it, do any smoking. And if I do let you go off, right, I'm going to check on you, or, you'll text me after 10 minutes or something like that and let me know how things are going. All right. So it's helpful for the parents, family members to know the risks, as we've talked about before, and all the harm of marijuana. So in case their kids ask about it, they can They can tell them some good education for them. And so, as we've mentioned before, some of the risks of marijuana can be harming brain development. Um, IQ can drop 8 to 9 points in adolescents, actually, if they use marijuana heavy enough. Their attention, their concentration can have problems, problem solving, learning and memory, lack of balance, poor judgment. And we've mentioned it before, they can get addicted to it, which can create more problems. Also, mental issues, and then just feeling less satisfied in life. Also, as parents and family members, it helps if you know the signs of use, so you can recognize maybe if your kids are lying to you or might be using it but not wanting to tell you. Yes, maybe they ask you for money a lot or seem to be out of money. Bloodshot eyes, if they use a lot of eye drops. Uh, their clothes obviously could smell like it. Maybe they use incense or deodorizers to try to take away the smell. Maybe some drug themed clothing. So those are things that you can look for to see if um, kind of give you clues or evidence that something might be going on. And of course, letting them know that you care about it, right? Always coming from a place of love, and that you're doing these things and setting boundaries because you care about them, what's best for them, and you'll always be there for them no matter what happens and the choices that they make. And then as they continue talking, as they continue aging, rather, to continue to keep that door open and conversations going. All right. So then, ways to create greater safety for the addict. Um, you definitely want to remove all the substances, right, that are known from the house, and this could also be drug paraphernalia. And so, there's a lot of different items that can be used to smoke marijuana, such as rolling paper can be used for cigarettes. A cigar can be used to make a blunt. Pipe can be used to smoke marijuana, or a bong. Roach clip is like a metal clip used to hold a marijuana cigarette. Also, e-cigarettes can be used to smoke marijuana extracts. And then finally, there's a grinder that can break the marijuana up into smaller bits. So if there's any of those things, you want to confiscate those things so that they don't have any temptation to use. Another good thing you can do is create an exit plan for them. So in other words, okay, if your friend asks you to smoke, what are you going to do? What's your plan, right? And then you can practice it with them, maybe in a safe place at home there, just so that they feel comfortable and confident that they'd be able to do that. Connect them to support group or counseling. That's what we've mentioned before with the 12 steps or the peer support. You can encourage them, of course, to spend time with friends who aren't going to do drugs. This, the more they can be around people that are going to encourage them to stay sober and away from the substances, easier it will be for them to recover. And then encouraging them to do healthy habits to relieve their stress. Depending on what their reason for using is, maybe you can help them replace that negative habit with something that more healthy, such as sports or um, community interest group, something like that. All right, so that is our presentation, and here are all of our references. There's one more page. That we got a. Yep.
We'll send them over to you, Dr. Beinert. Thanks for watching.
All right, thank you so much.
Yeah. Oh, I need to stop recording.
You gotta stop.